Welcome to OOTO TV, the out-of-the-office investigation from the past into the future of health. This time, we're embarking on a really vital conversation about understanding osteoarthritis, causes, treatments, and supplements. We're here to distill down the most crucial insights for you, our listener, from the sources you've shared with us.
That's right. Our mission today is, well, to cut through some of the noise, extracting those surprising facts and essential takeaways about osteoarthritis so you can feel truly well-informed on what's a very widespread condition.
Exactly. Because honestly, when we talk about understanding osteoarthritis, treatments, and supplements, we're discussing areas that significantly impact your health. This isn't just about like a sore knee or hip. It's about a much bigger influence on your overall well-being.
Precisely. And what's really fascinating, and something maybe not everyone realizes, is how understanding osteoarthritis, causes, treatments, and supplements dependencies drive mobility and pain management that can result in significant mood swings. It's a condition that really touches every part of a person's life, and we're aiming for a comprehensive look today.
Okay, so what's on the agenda for this investigation? We'll kick things off by defining osteoarthritis, digging into its underlying causes, including some risk factors that might surprise you, stuff beyond simple wear and tear.
Then we'll move into the traditional medical treatments that are available. And a pretty big chunk of our discussion will scrutinize the, let's say, often complex world of dietary supplements. We'll really dive into the evidence for popular options like glucosamine, chondroitin, creatine, collagen, and turmeric.
Right. And finally, we'll bring it all back together, looking at the broader picture of lifestyle. We'll emphasize the profound and maybe often underestimated impact of movement and diet on managing this condition.
It's really about empowering anyone navigating OA, giving you the information you need.
Okay, let's jump right in then. First up, let's just get a solid grasp on osteoarthritis itself. I think this condition is way more intricate and, frankly, impactful than many people realize.
I agree. Osteoarthritis, or OA as it's often called, is a chronic, debilitating condition. Its primary feature is the degeneration and loss of joint cartilage. Imagine that smooth, protective cushion in your joints, the thing that allows for effortless movement. Well, in OA, it slowly wears away.
And when that crucial cartilage is gone, what are the immediate effects? What happens inside the joint?
Well, the consequences are pretty profound. Once that cartilage degenerates, it leads to direct damage to the ends of the bones that meet in the joint. The body, tries to compensate by growing new, well, they call it remodeling, but this often results in bone spurs and changes the actual shape of the joint. And the combined effect of all that is the classic set of symptoms people experience: joint pain, inflammation, tenderness, stiffness, and importantly, a significant limitation or sometimes even a complete loss of movement in that joint.
Yeah, it's no wonder people often end up seeking medical help, mainly because the pain becomes, well, intractable. That really says a lot about how severe these day-to-day symptoms can be.
It absolutely does. Now, just think for a second about how amazing healthy cartilage actually is. It's this firm, sort of rubbery material covering the ends of your bones. Its job is twofold: reduce friction when you move and act as a vital shock absorber.
And the way it handles shock is like genius.
It really is. This incredible ability comes mainly from its water content. Cartilage is about 65% to 85% water. This water gets redistributed when you move, coating the cartilage surface when force is applied, and then it's reabsorbed when the force is gone, letting the cartilage bounce back to its shape. And crucially, cartilage doesn't have nerves, so these shape changes themselves don't actually cause pain.
That's a really key point for understanding where the pain in OA comes from later. So what happens to this amazing structure when OA starts to develop?
Well, in OA, there's a slow but progressive depletion of collagen and proteoglycans. Those are the fibrous proteins and the sugar protein combos that give cartilage its structure and its ability to trap all that water.
Right.
So this disruption messes up the cartilage's network. Initially, the water content might actually increase, but ultimately it leads to the cartilage breaking down and being destroyed, a process called catabolism. There are specific enzymes and inflammatory molecules involved in this breakdown, though the body also has processes trying to regenerate cartilage anabolism. It's like this ongoing battle within the joint.
That makes a lot of sense. And, speaking of causes, a lot of people still think OA is just simple wear and tear from getting older. But the sources we looked at revealed some really surprising findings beyond just that, didn't they?
They certainly did. While age is definitely a risk factor, it's far from the only cause, or maybe even the main driver for everyone.
So, for instance, What about things like high-impact sports?
Yeah, that's a big one. Vigorous sports activities that involve a lot of high impact and torsional loading. So
Hmm.
lots of twisting, turning, sharp diagonal cuts. Think soccer, football, basketball, tennis, baseball. These can significantly increase your risk of developing OA later in life. These aren't just gentle jogs.
That distinction is so important, especially because other types of exercise like walking, jogging, resistance training, functional exercises, these actually do not seem to increase OA risk. In fact, these moderate activities can actually improve joint strength and mobility, which is fantastic news for you listening.
It absolutely is. And to really highlight this, there's a fascinating study that compared long-distance runners aged between 50 and 72 to a control group of non-runners from the community. This study found that the runners actually had less physical disability and managed to maintain more functional capacity. They also had about one-third fewer doctor visits, though those visits were mostly for running injuries, interestingly, not OA.
Okay, but here's the kicker, right? The study found no significant difference in the amount of osteoarthritis that developed between the runners and the non-runners. That just completely challenges the common assumption that pounding the pavement for years inevitably wrecks your joints.
It strongly suggests that the overall health benefits you get from consistent physical activity might actually outweigh any potential wear and tear effects for many people. It's quite remarkable.
So beyond activity levels, what other factors play a role in someone developing OA?
Well, there are several other influences. Joint alignment is one. Things like being bow-leg or knock-kneed can change how stress is distributed across the joint. A history of joint injury or surgery, like a meniscal tear or an ACL reconstruction, significantly boosts the risk. Also, joint instability or hypermobility, sometimes people call it being double jointed, where ligaments are maybe a bit too lax, that can contribute too. And then there are more general factors like above average body weight, which just puts more mechanical stress on weight-bearing joints like knees and hips, and also general muscle weakness because strong muscles help support joints and maintain proper alignment.
You're listening to OOTOTV with research by author Paul Bielo.
Okay, so now let's shift gears a bit from understanding what OA is to looking at the available treatments. Traditional pharmacotherapy, medications often provides what doctors call palliative relief. Basically, it helps manage the symptoms, mainly pain and inflammation, without necessarily fixing the underlying joint degeneration.
So what do the major medical guidelines, like say the American College of Rheumatology, typically recommend for these traditional approaches? What are the go-to options?
For knee OA, they generally suggest starting with things like acetaminophen or oral or topical nonsteroidal anti-inflammatory drugs, NSAIDs. Tramadol is another option, or sometimes intra-articular corticosteroid injections right into the joint. For hip OA, the recommendations are pretty similar, just excluding the topical NSAIDs. And these drug treatments are usually recommended alongside non-drug measures like weight management and aquatic exercise.
But let's inject some important context here.
Mhm.
While NSAIDs can be effective for pain, they definitely aren't without risks. We're talking about potentially serious side effects
Yeah.
like upper gastrointestinal problems, ulcers, bleeding, and even cardiovascular risks like stroke and heart attack. That's why guidelines often stress using them cautiously, maybe with other medications to protect the stomach, or choosing specific types of NSAIDs carefully. It's a real trade-off you need to weigh up.
Absolutely. And this naturally leads us into the, well, often less regulated landscape of dietary supplements, which can feel a bit like the Wild West for consumers sometimes.
Yeah, and look, I'm incredibly enthusiastic about the potential for supplements to help manage OA symptoms, but it's crystal clear that you need a critical eye here. Under the 1994 Dietary Supplement Health and Education Act, these products are not evaluated and approved by the FDA before they hit the shelves. The responsibility for safety and making accurate claims, that falls on the manufacturers. The FDA basically has to prove a product is unsafe after it's already being sold.
And this is exactly why choosing the type of vitamins and supplements for understanding osteoarthritis, causes, treatments, and supplements is critical. Studies have found some really concerning quality control issues. For example, products not containing the type or even the amount of the ingredient listed on the label. We saw data showing glucosamine content in some products ranging wildly from just 53% up to 138% of what the label claimed. And many chondroitin supplements fail to have even 90% of the claimed amount, with some containing less than 40%. Plus, there's the risk of contamination with things you definitely don't want, like pesticides or lead. This inconsistency really impacts whether a supplement might actually work for you and whether it's safe.
That's genuinely alarming. Okay, so let's try to navigate this tricky landscape and look at some specific popular supplements. First up, maybe the most well-known pair, glucosamine and chondroitin. What's the thinking behind how glucosamine is supposed to work?
Well, the theory is that glucosamine stimulates the cartilage cells, those are called chondrocytes, to make new components of the cartilage matrix. However, the concentrations that showed effects in lab studies, in vitro, were incredibly high, like 100 to 1,000 times higher than the levels actually achieved in the human body after you take it orally. The bioavailability, how much actually gets absorbed and used, is only around 25%.
So a massive gap between the lab bench and what happens in your body. What about the clinical trials then? Do they show it works in people?
It's really a mixed bag. Some trials, often sponsored by the companies making the product using glucosamine sulfate, did show some modest reductions in joint space narrowing over several years, suggesting maybe it slows progression a tiny bit. But other large independent studies, like the big NIH-sponsored GAIT trial, which looked at glucosamine hydrochloride, found it was no more effective than a placebo for pain relief. So because of these really inconsistent findings, major groups like the American College of Rheumatology still don't recommend glucosamine for OA.
Okay, so glucosamine is questionable at best, it sounds like.
Yeah,
What about chondroitin sulfate? I've heard that might have slightly stronger backing, at least from some European groups.
you're right there. Organizations like ESCEO, that's the European Society for Clinical and Economic Aspects of Osteoporosis, Osteoarthritis, and Musculoskeletal Diseases, they do recommend oral chondroitin sulfate for pain relief and improving function in OA. And studies using highly purified pharmaceutical-grade chondroitin sulfate, often called HPCS, have shown some pretty positive results. Things like stabilizing the joint space width, reducing pain and functional limitations, and even decreasing cartilage volume loss and inflammation within the joint lining, the synovium. Some studies even found its effectiveness was comparable to certain NSAIDs like diclofenac or celecoxib for reducing pain and improving function. So that's definitely more promising.
But, and this feels like a recurring theme, there's a crucial difference here, isn't there, between that pharmaceutical grade stuff used in studies and what you typically buy over the counter. The quality really matters.
Oh, it absolutely does. That's a huge caveat. Pharmaceutical-grade chondroitin sulfate undergoes incredibly strict quality controls. They ensure its purity, its molecular weight, its consistency. In stark contrast, many food supplements often contain low-quality chondroitin, sometimes sourced from multiple different animals, and they're much more likely to be contaminated or have inconsistent dosages. So this massive difference in quality means that the supplement you pick up at the store might not give you the same benefits seen in those rigorous clinical trials using the high-quality stuff. It's a critical distinction for you to be aware of.
That's incredibly important for listeners to grasp. Okay, let's pivot to creatine. Most people think of it for muscle building, but there's some really exciting emerging research looking at it for bone and maybe even joint health.
There is. Beyond its well-known benefits for increasing muscle mass and improving exercise performance, creatine supplementation seems to have some interesting anti-inflammatory and anti-catabolic properties. Basically, it might help create a better environment in the body for muscle and bone growth and recovery. Animal studies have shown it can reduce inflammation markers, kind of like NSAIDs in some models. And in humans, it's been shown to lessen certain inflammatory responses after really intense exercise and reduce markers of muscle damage.
Okay, but just to offer the other side of that coin, some studies haven't found an effect on certain inflammatory markers, like C-reactive protein, depending on who was studied or what kind of exercise they did. And one study specifically in knee OA patients showed creatine had no effect on their inflammatory markers or markers of cartilage breakdown. So while it's promising in some areas, the picture isn't totally consistent for inflammation in OA itself yet.
That's a fair point, and it definitely highlights how complex these biological responses can be. However, looking specifically at bone health, creatine seems quite promising, especially when you combine it with resistance training. That combination seems key. It's been shown to reduce muscle protein breakdown, particularly in men, and also decrease bone resorption, that's the process of bone breaking down. For instance, one study showed older men doing resistance training with creatine had a significant drop in markers of bone breakdown in their urine. And in postmenopausal women, taking creatine along with resistance training for a year helped reduce the loss of bone mineral density in their hip.
And it's fascinating, beyond just muscle and bone, that other studies have found creatine might improve memory, especially in vegetarians, and even help with blood sugar control in type 2 diabetes patients. Again, when combined with exercise. It really seems to be a versatile compound.
Definitely. Okay, next up, let's talk about collagen derivatives, things like collagen hydrolysate, or CH, and undenatured collagen UC. This is a particularly exciting area, obviously, because collagen is, well, the main structural protein in our cartilage. It's literally the building block.
Right, and the theory seems pretty intuitive, doesn't it?
Yeah.
The idea is that supplementing with these collagen bits might stimulate those cartilage cells, the chondrocytes, to synthesize new cartilage matrix. And there's even evidence that these collagen peptides actually accumulate in cartilage tissue after you swallow them. It sounds like it should work.
And, preclinical studies, mostly in animal models, do show some promising chondroprotective effects, meaning protecting the cartilage. But UT, and this is a really important counterpoint, some lab studies in vitro using actual human cartilage cells have concluded that certain collagen hydrolysates, depending on where they came from and their molecular size, were either ineffective or in some cases even detrimental to OA cartilage cells.
Whoa, detrimental. Okay, so while the basic idea sounds good and animal studies look positive, the direct lab results on human cartilage cells throw a bit of a wrench in the works. What about clinical trials in actual people with OA?
Well, the clinical trials that have been done generally report improvements in symptoms and quality of life for OA patients using either oral or sometimes intra-articular injected collagen derivatives. However, another caveat here, it's crucial to realize that most of these trials were pretty short-term, maybe a few months, and relatively small scale. There are very few really robust, large, long-term randomized controlled trials comparing collagen to placebo. So the overall quality of the evidence is often rated as moderate to low, partly due to limitations in how the studies were designed, and also significantly due to potential bias because many are funded by the industry making the products.
So it sounds like with collagen, we really need more high-quality, independent, long-term trials to be sure. We need a clear understanding of exactly how they might work, and we definitely need standardized products so we know what's being tested. Safety seems okay generally, but yeah, more solid proof is needed for these potentially interesting compounds.
Exactly. Okay, moving on to turmeric and its main active compound, curcumin. This is a really popular natural option, mostly known for its anti-inflammatory properties.
Yes. And I find turmeric incredibly interesting. Lab studies in vitro show it can modulate certain immune responses like the NF-kappa beta pathway in a way that's actually similar to how some NSAIDs work. That's pretty remarkable for a natural spice.
And there's actually some good news from systematic reviews looking at the clinical evidence too. They generally conclude there is a benefit of turmeric on knee OA pain and function when compared with a placebo. And even more strikingly, in some studies that directly compared turmeric to NSAIDs, the effects on pain reduction were similar between the two groups. But, and this is key, there were no significant adverse events reported in the turmeric groups in those studies. That makes it a very compelling potential alternative, especially given the known side effect risks of long-term NSAID use.
That sounds almost too good to be true. But again, let's add some necessary contrary commentary here. There are still quite a few uncertainties, right? Things like the optimal dose, how often to take it, and the best formulation are still pretty unclear. This is largely because turmeric itself isn't absorbed very well by the body. It has low bioavailability. So many studies use these special proprietary bio-optimized preparations, making it hard to compare results or know what dose of standard turmeric powder might work. Plus, one study actually found that a very high dose of a specific turmeric preparation led to a significant increase in adverse events, compared to placebo, things like stomach upset. Although lower doses in other studies didn't show that difference.
Exactly. And other limitations mentioned in the reviews include things like studies not always reporting if patients were also doing other things, like physical therapy or losing weight, which could affect results. They also often don't look at different types or phenotypes of OA or analyze if it works better for mild versus severe disease, and the follow-up periods are often quite short, maybe 8 months max. But despite all those limitations, the overall safety profile of turmeric, especially when you compare it to NSAIDs, is still a very strong factor that makes it worth considering for many people.
And just maybe a quick mention of a few others that get studied, like hyaluronic acid injections, diacerine, and avocado soybean unsaponifiables, or ASUs. While they've all been researched for OA, the results often seem inconsistent or less conclusive than some of the others we've discussed, really reinforcing just how complex finding effective solutions for this condition truly is.
You're listening to OOTO TV with research by author Paul Below. Okay, Bob, so let's try to bring all these different threads from our investigation together now in a recap. I think one major insight that keeps coming up is that OA is truly a multifaceted condition. It involves mechanical stress, yes, but also inflammation and metabolic factors. And this really drives home the point that finding a single magic bullet solution is, well, probably pretty unlikely.
Absolutely. And it's so vital to remember that understanding osteoarthritis, causes, treatments, and supplements exponentially leverage mental and physical interaction. This condition doesn't just affect a joint in isolation. It impacts your whole system, your mood, your ability to engage with life. It's all interconnected for your overall health.
So true. We've also really underscored how critically important it is for you, the listener, to scrutinize supplement quality and the actual scientific evidence behind the claims. Given the inconsistencies we've seen and the gaps in regulation, being a critical, informed consumer is just paramount for your health and your wallet.
And let's definitely not forget those often surprising, maybe even counterintuitive insights about exercise. It's not that all physical activity is bad for joints. In fact, certain types, even things like long-distance running that people often assume are harmful, can actually be protective and significantly enhance your overall function and well-being. That's a real paradigm shift for many.
It's such a powerful message, and this leads us directly into the incredible power of movement itself, just moving your body.
Exactly. And I get really enthusiastic about this part because movement isn't just about, say, building muscle strength, although that's important too. Movement actively helps your body produce synovial fluid. That's your body's own natural lubricant and nourishment system for all your joints. Think of it like giving your joints a regular oil change.
That's a perfect analogy. And the great thing is, there are practical, simple ways you can apply this principle for different joints commonly affected by OA. For example, for your hands and wrists, simple exercises like making the claw that's bending just the middle and end joints of your fingers, not a full tight fist, can help. Or making a tabletop shape with your hand, bending just at the big knuckles, spreading your fingers wide apart and bringing them back together. Even gently stretching your fingers back, using your other hand for a passive stretch. These simple movements can make a huge difference in loosening up morning stiffness and providing real comfort throughout the day.
Yeah, fantastic. And for the knees?
For knees, simple extension and flexion is key. Just sitting in a chair and kicking your leg out straight, then bending it back as far as comfortable. You might need to scoot towards the edge of the chair to allow your knee to fully straighten. Using support if you need it, of course. It just gets that joint moving through its range and helps lubricate it.
Great. And hips. Hips can be tricky.
They can, but there are good options. Seated, you can pull one knee up towards your chest for flexion and then think about extending the leg back behind you slightly. Standing, holding onto something sturdy for balance, you can gently kick your leg forward and then back, really focusing on moving from the hip without arching your back too much. Abduction and adduction, moving the leg out to the side and back in, are also vital, both seated with feet planted or standing.
And rotation too, right? That often gets forgotten.
Definitely. Seated, you can just swing your foot inwards and outwards, letting the hip rotate. Standing, you can imagine gently squishing a bug under your heel by twisting it inwards and outwards, or, if balance allows, doing slow, controlled hip circles, both clockwise and counterclockwise. It's really about exploring that full range of motion gently and consistently. It's amazing how these simple things add up.
And I'm incredibly enthusiastic to declare this too. Understanding osteoarthritis. Causes, treatments, and supplements interaction require that you manage your diet specifically for your needs to both create and become smart and relaxed. What you eat truly influences everything from background inflammation levels to your energy and even your mood.
Precisely. And this holistic view is just crucial because understanding osteoarthritis, causes, treatments, and supplements dependencies requires you to have a health plan, diet, and daily eating and sleep routine and process to provide the desired result for health. This comprehensive approach is absolutely fundamental for your overall well-being when you're dealing with a chronic condition like OA. It influences pain, function, mood, sleep, everything.
You're listening to OOTO TV with research by author Paul Bulow. So as we start to wrap up this investigation, what are the key things you, our listener, should really hold on to? Well, first, while traditional medical treatments are definitely important for managing OA symptoms like pain, the world of dietary supplements is clearly a very mixed bag. Some show glimmers of promise, others just don't seem to deliver based on good evidence, and the quality of what you buy can vary wildly. Always, always be a critical, questioning consumer.
And just as importantly, please remember that your lifestyle choices, especially finding ways to incorporate consistent, appropriate movement into your day and paying attention to a balanced, tailored diet. These are incredibly powerful allies. These aren't just optional extras. They are foundational pillars for managing OA effectively and supporting your overall physical and mental health.
Absolutely. So let me leave you with a final thought to mull over as we close out today's investigation. Given the perhaps surprising effectiveness of simply moving appropriately and the often conflicting or uncertain evidence for many popular supplements, how might proactively integrating a personalized movement and nutrition plan into your life not just help manage your current symptoms, but perhaps even reshape the very future of how you live with osteoarthritis? Something to think about. Thank you so much for joining us on this really crucial investigation into understanding osteoarthritis, causes, treatments, and supplements. It's certainly been an illuminating journey for us.
Yes, and we really encourage you to continue your own journey of discovery. Use these insights, ask questions, and apply what makes sense to your life. The more you understand, the more empowered you truly become.
Join us again next time for more investigations from the past into the future of health, right here on OOTO TV.
Until then, stay well and stay curious.